Hi, my name is Kennedy. I'm a student nurse at William Carey. I'll be performing your insulin administration today. Can you verify your name and date of birth? Okay, and I'm going to verify the physician's orders with the MAR. Okay, so your previous glucose measurement was elevated. So some signs and symptoms of hyperglycemia involve polyphagia, polydipsia, and polyuria. A sign and symptom of hypoglycemia involves shaking and diaphoresis. So as far as eating goes, are you full or hungry at the moment? Okay, and have you been noticing yourself eating excessively? Okay, and how many meals per day do you eat along with snacks? Okay, thank you. And what was the previous site that you had your recent insulin injection in? Okay, the right side of your stomach? Okay, is it okay if we do it on the left side of your stomach this time? Okay, and I'm just going to assess the skin integrity. Okay, there is no impaired skin integrity. I'm going to perform hand hygiene. And I am going to don clean gloves. I have my medication, NPH and regular. I'm going to verify the physician's orders with the MAR again, and I'm going to check the expiration date on the medication. I am going to lightly roll each medication in my hand. Okay, and I have a clean alcohol swab here. I'm just going to clean the vials. Okay, and I have my insulin syringe here. So the order is 16 units of NPH and 6 units of regular. So I'm going to draw up 22 units of air first. Okay, and I'm going to inject 16 units of air into the NPH without touching, with making sure the needle does not touch the medication. Okay, and now I'm going to inject the rest of the air into the regular. Okay, and I'm going to draw up 5 units of the regular. Okay, and now 16 units of the NPH, which is 22 in total. Okay. Okay, and I'm just going to place my needle back inside of its cap by doing a swoop technique. Okay, and I have my insulin here in my patient's room. Before I give my insulin, I'm just going to let another nurse check to make sure that I have the right medication and the right patient and the right route and right dosage and the right indication and documentation. And I am just going to, if I was not in the room with the patient, then I would label the syringe before walking to the patient's room. And now I'm just going to verify the physician's orders along with the MAR before I give the medicine to the patient again. Okay. And so I'm going to take an alcohol swab and I'm going to wipe the site that we're going to use, which is going to be the 2 inches away from the umbilicus. I'm wiping the site. However, ma'am, if you did not want to use this site, you could also use the back of your arms. You could also use the front of your thighs and the love handle area as well to inject a subcutaneous medication such as insulin. Okay, I've cleaned the site. I'm now going to remove my cap. I'm going to squeeze 2 inches of skin, and I'm going to inject at a 90-degree angle. Give the medication. Okay, and after giving the medication, I'm going to get a alcohol swab and apply pressure. I'm going to dispose of this in the biohazard bag or in the sharps bin. Okay, and after I apply pressure to it, I am just going to dispose of my gloves and the swab in the biohazard bin as well. I'm going to perform hand hygiene or wash my hands with soap and water, and I am going to document this procedure and document how the patient handled the procedure and how much insulin I gave.